Good afternoon, everybody. I just would like to take a moment to welcome everybody to Theraplay and Children's Dental Health Association's Facebook Live today. We're going to talk a little bit about therapy and children's dental and Theraplay and all of the amazing things that we can do together to partner, in addition to any concerns or questions that any of our families and patients might have in regards to dental health, in regards to dental hygiene, in regards to my kiddos having issues brushing their teeth. So a little bit about who I am, and then I will pass it on to everybody and kind of turn my camera off and let our speakers speak. My name is Carrie Stitsworth, and I'm the Community Outreach Liaison with Theraplay. So a little bit about Theraplay is we provide occupational speech and physical therapy for kiddos birth to 21, all in a play environment, as well as we have a comprehensive feeding and concussion program. So I'm out in the community building partnerships, and this is how one of our amazing partnerships kind of began. So I'm going to go ahead and pass it on to Kelly to introduce herself, and then we will continue on to all of our other speakers and get our conversation started. So take it over, Cal.
Thank you. So my name's Kelly. I am a pediatric occupational therapist. I've been with Theraplay for 6 years now. And I work a lot with our kiddos that have a hard time with maybe sitting for brushing our teeth. Those kids that are on the spectrum that have a really hard time just bringing any type of, things to their mouth, as well as, dentist visits, all those things. So I'm, as an occupational therapist, I'm really looking at it as a sensory piece, looking at the whole environment and the activity. That's the challenge, and how the sensory pieces can play a role in that. So yeah, that's just a quick little touch about me. Sam, if you want to go right ahead.
Sure. So I'm Sam. I am a pediatric speech therapist. I've also been with the company for about 6 years. I work out of our East Norriton location. So what I work on is speech sound production, articulation. We work on feeding skills as well. So the oral motor aspect of feeding. We can look at tongue tie and lip tie to determine if there's a functional impact on either feeding or speech. And then as a speech therapist, we also can work on some different language skills, social skills, pretty much anything involved in functional communication.
Tahita, would you like to introduce yourself?
Sure. Hello, my name is Tahita Muhammad. I am a registered dental hygienist. I currently work with Children's Dental Health in Wilmington, Delaware. I've been in practice for about 20 years. I am a parent of a child with special needs. I do a lot of research on special needs dentistry. I work with the University of Delaware and their LEN program for the university and their Center for Disability Studies. I am currently getting my master's in public health to kind of help close the gap for the special needs dentistry aspect, because there's not a lot of education within that component of it. And I see a lot of patients here in our Delaware offices who have special needs, and I'm usually like the go-to person for any type of questions or advice on how we can better service our patients with different needs.
That's awesome. I didn't realize you were going to school for your master's, and that's amazing that you're trying to bridge the gap in that way. I feel like that's a lot of times what happens, just not having the knowledge that is out there, that there are so many things that we can do to help across the board, and families are just sometimes just struggling with thinking this is just not going to work, and they just kind of accept it. But knowing that there are specialties out there, or people that have the training and the education to kind of support you and work through that, and it doesn't always have to be such a challenge. I think that's great.
Yes, so that's the one great thing about Children's Dental Health. We're a pediatric dental office, and pediatric dentists, they get extra training for individuals with special needs. So our doctors here, they have training, and they're specialized to treat individuals with different needs.
That's awesome.
That's great. I think a lot of times some of our parents don't always take their kids to the dentist because there's fear associated, they don't know what to expect. So just knowing that there is a place where they can bring their kids, where they're trained and know how to work with them, is great for us to be able to guide our families on that resource too.
It is. It's very common for parents not to. And studies show that dental care is the most leading unmet healthcare need among individuals with special needs. And primarily, I mean, there's so many different reasons. One of the main reasons is parents, they're reluctant because you have so many other appointments and other things you have to do. But then also to finding a provider that's willing to provide adequate care for these individuals. And even like a lot of studies show that a lot of dental professionals, they're not adequately trained to provide this type of care. And a lot of parents don't know that pediatric dentists, like us here at Children's Dental Health, are trained to do so.
I think that plays a huge role too in just like, if you have a dentist that maybe doesn't have this, you know, training, and they don't have the certifications in being able to support the families, like knowing that there are other professionals out there that can support you to go to the dentist. Like I said, like as an occupational therapist, I work with families all the time, trying to break down why the dentist is so scary or what is really hard within that whole routine. I work in the outpatient, but I also work in the early intervention setting, so out in the community in the homes. And we talked a little bit about this in a previous call, but for those that do get early intervention services and they do have other disciplines coming into their home for therapy, this is a perfect time to kind of bring up some of these concerns to those professionals. I mean, as an occupational therapist, I could go to your home in the early intervention to help you in there, but I can go out into the community too. If the dentist is a really hard thing to do, then let's plan a session to go to the dentist appointment, and I can support you and your child and your family and the dentist, giving them techniques to support that whole activity. I just think it's just not known enough that we can help. And again, if you're not in early intervention services, just knowing that there are other specialties out there that can provide strategies and tips and tricks, should your dentist not be, you know, have that training or that, you know, that way to support your kid in that.
I agree. And even too, like I know a lot of times, like with speech therapy and occupational therapy, you know, we always want to do early intervention. The same thing with dentistry. The American Pediatric Dental Association, we recommend that children see a dentist by the age of 1. You know, usually around 6 to 8 months is usually when a child gets their first tooth. So by the age of 1, they should have a dental home, is what we recommend. And the main reason for it is because you want that child to get in there early, so that way you can see what's going on, and just introducing the dental office and brushing at an early age, so that way the child can get used to coming to the dentist, used to brushing their teeth. And even, you know, if there is sensory issues, things we can teach you and help you to work around that. And it's easier to start when they're younger because it's easier for the parent also. So you're able to do these things at a younger age and do it at home, opposed to if the child is 10 and they're just coming in, because then it makes it's new for all of us. You know, it's gonna be new for that child. It's gonna be a little bit more difficult for the child and difficult for the parents also. So we just recommend, again, just like with everything else, you know, you want to do early intervention for speech, you want to do early intervention for occupational therapy, physical therapy. Same with coming to the dentist and going to the doctor. You want to introduce the child as much as possible at an earlier age, so that way the child has, you know, they know more about it. You know, they can start, you know, at an early age and they're familiar with them, getting more familiar, creating a routine about it. Even with at home, at brushing at home, you know, make it a routine. Do it the same time in the morning, the same time in the night. You know, after you eat breakfast, it's time to go brush your teeth. At night, after you eat dinner, it's time to brush our teeth. Make it a routine, because a lot of times children with special needs and different needs, they're used to routine. And if you have that routine, it just becomes second nature.
Mm-hmm. I agree. I think early intervention is key. I mean, I think we see that across the board, not even just for toothbrushing, right? Like if I think Sam can say this too, but when we have kids that come in for feeding difficulties, as an occupational therapist, I also see them, just like Sam mentioned, she does as a speech therapist. But it's key to get there early, because we can address if there's anything going on underlying. Why are we a picky eater? You know, can we provide support? Sam can talk to you a little bit about the oral structures of how that can impact them, how they're going to eat, and why they're pushing certain food out, because maybe they can't manage it, or is there a sensory piece to it? And I think if we can get in there sooner than later, you know, we're helping to provide strong foundational skills that they need, so that whatever, if it may be brushing our teeth, eating something specific, you know, whatever the challenge is, we're getting in there sooner than later, so that that's not a learned behavior. It's not a learned fear. It's not, you know, engrossed in our being to avoid this. We're working through it at a young age and providing the support then.
Yeah, definitely. And with the feeding, I think a lot of times too, sometimes the dentists are the ones to find the tongue tie or the lip tie, because they're in the mouth more than the pediatrician is, or then the parents might not even notice. So sometimes too, they're the ones to find that. And when there is that tongue tie or lip tie, what we can do as speech therapists is we can take a look and see, is it functionally impacting their ability to move their tongue, to move their lips, to manage the food? Are they having trouble eating because, like Kelly was saying, they can't physically manage it in their mouth? Or is it something where they don't like that taste or texture, or they're sensory aversive to it? So knowing the whole picture too of what's going on inside of their mouth is really important. And even if, you know, they've been to the dentist, that means they've had someone in their mouth. They've allowed someone to look in there and they're more comfortable with it. For speech feeding, especially, we need to be in their mouth. We need to see what's going on. We need to use different, you know, tools and different things to play with. And if they're already comfortable with that, and that's an experience they've had, that's so helpful for us.
Yes, that is important too, because even also too, a lot of times children with developmental delays and different types of special needs, they can have different anatomy within their mouth. You know, they have developmental delays with their growth as far as the eruption of the teeth, like tongue ties and lip ties. A lot of times we'll see children come in earlier than age 1 because they have issues maybe with nursing. You know, they're not able to latch, and the parents will come in, you know, because their pediatrician maybe referred them in, you know, for a consult for maybe frenectomy, to have the tissues, you know, laserly removed, so that way they can eat better and feed better. Then as they get older too, a lot of times parents will come in and say, you know, the school said my child has a speech issue, you know, can we make sure there's nothing like anatomy going on with the anatomy that's maybe affecting their ability to articulate and say certain things. So we definitely do see that a lot too. And we get a good look because we're looking at all the different features, you know, making sure everything's coming together in a holistic way, making sure, you know, if there is a delay with the eruption of teeth, make sure there's not a reason for it other than, you know, like something like blocking it, like if there's any other issues going on. So, you know, we try to do x-rays and even just like a physical look to see what's coming in and what's going out and what's making sure everything looks good.
Yeah, I actually had a family come in today for articulation concerns, and one of the questions they had was, you know, the dentist mentioned spacing issues. Could that be impacting the speech sound production? And we were talking about it, and it definitely can. If there is, you know, if they're missing teeth, that can impact the speech sound production. If there are, like you said, any abnormalities in the structure, it definitely can have an impact. And we can't fix that. We need, you know, to collaborate with the dentist to figure out, do we need a palate expander? Do we need braces? Do we need to wait until the teeth come in? You know, what do we need to do and how does that impact it? It's definitely all connected.
Exactly. And we'll see that a lot of times too. Some children will have like a narrow palate and, you know, you may need some expansion because depending on, you know, the roof of your mouth, if the way your tongue sits, you know, you're not able to articulate certain words, you know, because your tongue isn't in a neutral position where as it should be. And a lot of things, you know, we can do like early orthodontic work, expanders and things like that. And once you get in there and see that, you won't know until, you know, you had that type of visit coming to the dentist.
Yeah. One question I actually have, Tahita, is in terms of pacifiers, what, from a dentist perspective, do you recommend? As a speech perspective, we definitely like to see them eliminated by the time they're starting to really talk, you know, except for at bedtime. But do you have a different recommendation from a dental perspective?
We recommend by the age of 3 that they should be done with the pacifier completely. A lot of times children, for prolonged pacifier use, you'll notice an open bite. And that's basically where your mouth starts to take the shape of the pacifier. So research and studies show that if a child is done with the pacifier by age 3, even if they have the open bite, your jaw can kind of reshape itself. But any prolonged use after the age of 3, it won't. And you'll, end up with the open bite where your teeth won't come completely together. So we just recommend, like if the child's 1, to try to start phasing it out. And it's like a lot of different methods. Sometimes we recommend, poking a hole in the binky so it doesn't have that same sucking mechanism. Recently, there's a pacifier weaning system that's out on the market now. It's made by the same people that made the nose Frida thingy. And a lot of parents that I know, they use that and they gave good reviews. But we recommend too, like if the child needs it, just trying to lessen the time they're using it. Like a lot of times need it for comfort to go to sleep. So, okay, let's do bedtime and not nap time and bedtime. Try to encourage the child not to use it throughout the day. One of the things is you don't want to take it too early when the child's not ready, because then they're going to find their fingers and then you can't take their fingers. If you have a thumb habit or a finger habit, then it makes it even harder for the child to get rid of it. A lot of times children with special needs, they'll need their pacifier longer because they need to self-soothe a little bit more than some other children. Just like a lot of times too, children with special needs, they may be on a bottle longer than typical children. So, you have to take those type of things in consideration. It may not necessarily always be an age thing, physical age thing, but more of a behavioral age than a physical age too. So we have to take those type of things in consideration. But usually just trying to wean the child slowly, and having the child, aware of it. Once the child is aware, okay, maybe they don't need it anymore to go to sleep. You say, okay, let's try to do every other night, just decreasing the amount of use to help them finally get rid of it.
Yeah, that's definitely helpful.
But it's definitely a hard thing. I'm sure if anybody knows a parent and their child took, a pacifier, it's one of those things it's just easier to give it to them than to have them cry and fuss through the night. I mean, it's soothing. Most children use it to soothe themselves. So I think, it was one of those constant battles, like, okay, do I let my child cry it out at night, or do I just, give them something simple like a pacifier that's going to help them? And, and it's no harm, in doing so, just like long term, it causes, different changes the structure of the jaw.
Looks like we have a question here. So it says, is there a specific type of toothbrush you recommend for children with brushing difficulties?
For children with sensory issues, I always just recommend a manual toothbrush. I just think it's easier, it's been around for a long time. We all know they work and get the job done. Always like a soft bristle brush. And I always recommend a toothbrush with like a small head. The smaller the head for me, it's easier for you to get in and get things done. Like I know right now in the market, there's a lot of different brushes. I mean, it's not a lot of research about them. You have like different brushes you can put in and like vibrates and do the top and the bottoms at the same time. It's not a lot of research about them, so I can't give you my honest opinion on it because I don't know. And we all know a manual toothbrush works. Use it. It's just about getting in there, using it, getting all the surfaces, taking a nice amount of time and cleaning everything. It's just a soft bristle brush. A lot of times, like the electronic brushes or brushes that vibrate, for children with sensory issues, it's not a great thing. They won't like it. They won't respond to it. So you start always with a soft brush, using like small little circular motion to go around and brush and just get in every tooth. And the gums is usually the best method.
Yeah, another thing we see sometimes in feeding is a hypersensitive gag reflex as well, which I'm sure would impact dental work. So a lot of times what we'll say as speech therapists in terms of feeding is we'll encourage parents to let kids play with toys in their mouth, put those toys in their mouth to move that gag reflex further back. I don't know if either Kelly or Tahita, if you have any suggestions for that as well.
Yes, a lot of times even here in the office when we're seeing patients, they have a severe gag reflex. For that, usually I'll have the patient sitting upright, kind of having them lay back. A lot of times in the office, you lay back, it's going to kind of initiate your gag reflex to be a little bit stronger. So if this patient is sitting upright, they're less likely to gag. And also to always using like a tiny little bit of toothpaste. You can brush your teeth, like the child's teeth, with no toothpaste at all, and it'll help decrease the gag. And then like, towards the end, when you're done, after you reached everything, just from the mechanical brushing, use like a tiny little smear of toothpaste to help them, just to put like the toothpaste on and freshen their breath and like the fluoride and stuff. But then also too, a lot of times children gag because of the taste of the toothpaste. And a lot of times kids with sensory issues, they have taste issues and texture issues. And there's on the market now, there's a lot of different toothpastes to choose from. You just got to kind of like play around and find one that works for you and your family. And they even have like toothpaste now, like with absolutely no flavor, and it's just like smooth and no consistency, but it still gives them, some of the benefits that they need from the toothpaste.
I was going to say too, from a sensory perspective, I think always taking like a step back before just going right into the mouth, right? Because like sometimes even regardless of the type of toothbrush, if we go right towards the mouth, we're automatically in moments of distress because we're afraid of it, or we just don't want anybody near our mouth. So as an occupational therapist, from a sensory perspective, I'm trying to find out where the kid is at. Like, are they willing to even hold the toothbrush and engage with the toothbrush, play with the toothbrush, and then work on that sensory system of, okay, we are not ready for it to come into our mouth, but can we start at our fingers and start brushing our fingers and then work all the way up our arm, and then maybe just do some massage near our cheeks. And then as we start to desensitize that area and wake up those muscles and that sensory system, we may find that we have less sensitivity to then bringing it towards our lips. And we're doing some there, and then again working it as a gradual process, and then working our way into our mouth, getting that trust, building that foundation that the child needs. A lot of times our families are just like, I just got to get it done, which I totally understand. We just go right into it. But if we want to have lasting change, we will really truly do want to see this routine or activity improve and them to be successful in it. We do have to do a little bit of that prep work and try to meet them where they're at, and then slowly work our way in there. I've done things just like, maybe the toothbrush is too much. So maybe it is a vibration. Maybe they really like vibration, and we just start here and just being able to tolerate vibration on our cheeks even, or our lips. Maybe it's not going into our mouth, but just trying a bunch of different sensations, using a rag if the toothbrush is too much, and just trying to, again, bring some awareness to that piece. I've even had family do like finger painting with toothpaste just to get used to the taste, and we're super silly and we're playing around with it, and maybe we'll get it on our lips. Just again, another way to introduce this type of texture and taste in a non-threatening manner to help desensitize some of that fight or flight reaction that we typically get when we automatically go to to brushing the teeth. So trying to find ways to meet your kid where they're at. And again, it does take more time, but it'll help promote more lasting positive change versus just going right on in there, especially if we have a lot of that sensory sensitivity, because we want to promote positive, a positive experience for the child. So,
and just to piggyback off that, that's another reason why early intervention is important too, because when a child gets their first tooth at 6 months, you start off with a finger brush. Getting them for a little, you don't even necessarily have to use a toothbrush, but getting them used to having a brush in their mouth. At 6 months, starting going around brushing teeth. At age 1, they can start holding a toothbrush. And when you're brushing your teeth, the child can sit there and brush their teeth too. Make it like a family affair, and can all go in the bathroom and brush your teeth together. But again, it's like starting early so they're comfortable with it. They know what a toothbrush is, from an early age, and just starting at that early age. Because typically when we're all starting out brushing our kids' teeth at, a year, they're going to fuss at you. Just like with anything, if you're changing their diaper, it's just one of those things. They don't like you have to clip their nails. It's one of those things that most children don't like already. So sometimes it's always going to be like a constant battle for it. But I just think like it's one of those things too. And I always tell my parents too, even when they come here, they're like, oh, they hate when we brush your teeth. It could be like a 1-year-old. I'm like, oh, most kids do. They don't like getting a toothbrush, but it's just like all those other things that we have to do. We have to do it, and you just have to make it important. And I think over time, if children don't like it initially, if you constantly do it and you get in a routine to do it, over time, the child, most likely, they stop putting up as much resistance because it's constantly being introduced to them every day. Then they realize, oh, you know what? It's not that bad. You get used to it, you get comfortable with it because you're introduced to it, multiple times throughout the day. It becomes, one of the things like, oh, it's almost time for us to do that thing that I don't like, but you know what? We did it last time and it was okay.
I think talking about that too, just in general with the routines, I think some of our kids, especially with some different language difficulties, benefit from knowing what to expect too. So even when, we see them a lot of times twice a week, if the parents let us know, hey, we have a dentist appointment coming up, we can talk them through too, like, here's what to expect. You're going to go in the waiting room just like you do here. You're going to go sit in the chair. And even just kind of preparing them and talking about it ahead of time. I don't know if children's dental, if you have anything that you give families ahead of time, but that's definitely something like we as therapists who see them all the time can let them know too what to expect.
Yeah, it's kind of like a picture story. A lot of times like children work well with that. There's a lot of things on social media, like I tell parents all the time, they're, apprehensive about their first visit. You can look online and do like different like picture stories, like my first visit to the dentist. There's all types of books on it. Like Elmo has a book. I think Winnie the Pooh, I'm sure Coco Melon, all of them probably have books coming out soon too, because it's a common topic. People worry about it. Like I know Bearston Bears, they have a book, back from when I was younger. So it's like one of those things, you just like picture stories. A lot of times kids with special needs, they work, easy. They can see the pictures, they know what to expect and what's going on. And then even too, like just talking to the child about it too. Some kids it work great for it, and some other kids they may have the anxiety piece, whereas though they don't want to know or what to expect. But here, when they're in the office, we show, see, and do. Like we show the kid everything we have and what we're going to do. Like we'll show them on their hand, like we'll count on their fingers, put the toothbrush to their hand, to their fingers. Let them smell the toothpaste, make them pick flavors. We have tons of different flavors they can choose from. And then like we even like take the brush the profile angle to their fingers, take the mirror, let them hold the mirror, let them look in the mouth, let them look in the mirror and see what we're doing, everything. And, like talk them through the process and show them every step of the way what we're doing. So there is no surprises. We're not just coming at them with these, crazy instruments and things. And a lot of times too, for kids, they can sit on their parents' lap. So that way they have the comfort of their parent, or even too, they want to sit in the chair by themselves, they'll sit upright. We're just looking face to face and talking. And that's another thing too, I tell parents too, a lot of times you think you have to brush your teeth in the bathroom. You don't. Some kids don't even want to go in the bathroom. You can brush your teeth, at the kitchen table, on the couch while they're watching TV. They like playing with their iPad. They can play with their iPad. You can put a video on your iPad about brushing teeth and have them, brush their teeth the same way, if they like Elmo or the Ninja Turtles or whoever, find a video. Like that's a great thing. We have, so much access to the internet, and we can find a picture of whoever like your favorite character is with like a toothbrush. Give them a toothbrush with their favorite character and to kind of make it exciting about brushing. It doesn't have to be like it's boring, like routine, and all the things you do. You want to make it like a fun thing to do.
I was going to say, just to jump off of what you were just saying, is a lot of times too with the stories, we'll create what are called social stories, where they're very specific to the child. Like the child helps develop it. They pick out the pictures. It's all in first person, and it talks through different social situations or challenging routines that we need to work through. And so the dentist may be one, right? So it's all in first person. It talks about what to expect. We talk about our feelings in it, how it makes us feel, what we could do to help calm ourselves down in those instances. And it's such a great tool. We'll utilize it for so many different things. May it be the dentist, getting unexpectedly wet or whatever it is. And we use it as a tool that family reads it prior to the social situation. And in that moment of distress, like, wait a second, what did you do in the story, right? So like reflecting back onto it, we know the story, it's about you. We've made it together. We've read it a bunch of times. What did you do to help calm yourself down in this instance? And I find sometimes just that in itself, creating a social story that's very much individualized to that child is either even a step up versus, just the general story time about dentists and things like that. I find a lot of our kids really benefit from it. They're like, oh, yeah, you know what? I remember I took some deep breaths and I gave myself a nice big squeeze. Okay, let's try it. Let's do it together right now. And let's see how we feel. Sometimes that is another tool that, will work to develop for the families when we know there's going to be a challenging situation coming up.
Yes, and that too, we even encourage parents too. You can come to the office, tour the office with your child. You can come in, they can come in, look around, take pictures, and that way you can create a social story too when they're actually at the office, even if the parent wanted to come in, just take pictures to kind of show the child, okay, this is what the office looks like. This is what they're going to do. This is the chair you're going to sit in, things like that. Even if the kid just wants to come in and hang out in a waiting room and leave, that could be, you come in and do that. And then so the next time they come, oh, I was there before. It was cool. I watched TV. I got a toy. I got a prize, so kind of like leading them up to the point where, okay, we're going to look at your TV today.
Yeah. And I love your office. I was actually able to go see it, and it's so fun with all the character. Like it doesn't look like a doctor's office. It looks fun. There's decals on the walls, the movie's playing in the waiting room. So
Exactly.
I think that's awesome.
Yeah, and this was all about too, for kids. Kids, we look at things from a different perspective from what a child looks at. So you want to make the office look colorful and bright and make it look fun. So when a child walks in, they're not like, oh my God, I'm here. It's like, oh wow, look at this. Like this looks like, a play place, like somewhere you can go and have fun. It doesn't look like, okay, you're going to a dental office. You're going to, do that. So it's engaging for the child to look at.
That's great.
Did we have any questions from the?
It doesn't look like we have any audience questions yet.
Okay.
Yeah.
If that's everything, I just want to thank our presenters, Children's Dental Health. Thank you for joining us today. This has been a really, really interesting conversation. And just for everybody who's watching, a copy of this video will be posted to our Facebook page, and we'll also post it to our YouTube page as well. But yeah, just want to give you folks a chance to finish this off here.
Okay. I just want to make a point too. As a parent, when you're making your child's first visit, when you're calling in to make an appointment, if your child has different needs, make that aware, at the appointment when you're scheduling the appointment. So that way too, when the child comes in, we're going to approach that child differently. We are aware of your child's needs. We're going to do things differently. We have a standard of care that we provide for all patients, but, some children need more, things a little different. So if you let us know when you're calling in and making an appointment, we can accommodate your child to whatever accommodations they need. And then just encouraging parents, to get your child to the dentist. Like, don't be afraid. It's not a scary thing. The sooner the better. But even if your child's already a little bit older and they haven't been to the dentist yet, it's not too late. You can still bring them in. We're trained, we specialize, and, we want to see your kids.
Mm-hmm. I was going to say too, if you're not lucky enough to have the local dentist that has that trained ability to support, the special needs population, know that there are other professionals out there that can kind of help you with that prep. Like I said, as an occupational therapist or even a speech therapist, there's a lot of things that we can do to kind of prep you and your child, to give you guys the tools that you need to be successful. Because I know this is, being posted for all the different areas around. And so just know that we are here to help. And if you are thinking this is a challenge of my kid, and I definitely dread going to the dentist because of this, or toothbrushing is a huge challenge, know that doesn't always have to be that way. And we can definitely, get in there and try to help as much as we can.
Yeah. And fortunately enough, Children's Dental Health, we have offices in Delaware, we have offices in Jersey, and we have offices all throughout Pennsylvania. So, and all of our doctors and all of our staff, we specialize in children with special needs. So you can go to any of our offices and see which office is close to you to get in. And that way you can have, someone with some specialized training too. And even if it's not our office, you can always research, pediatric dentists in your area, or even, if other families, ask them, where do they go? Where did their child go to the dentist? How was their experience? Because that's another good thing too. You want to go where your child's going to be taken care of.
Absolutely.
And it's
Alrighty,
just
well, yep. Tita, Samantha, and Kelly, thank you so much for joining us today. This has been great.
thank you.
Thank you.